Well, good afternoon, everybody. And well, what a great conference we've had. And thank you all so much for attending. 500 of you actually attended, and you've represented 135 local health watches. As always, for me to highlight, the highlight of the conference has been the awards. 28 local health watches shortlisted, 3 great winners. What a wonderful showcase of everything that you do. We started off with Sir Michael Mummett, and what an inspiring framework for our conference that was, focusing on the equalities as we have done. I took away from what he had to tell us 2, I thought, telling phrases. One was, we don't have hard to reach communities, we have hard to reach services, and that is the right way around, isn't it? Start with the people, work out what they need, rather than here are the services. Oh, we can't reach people, we need to. And then the second one was, people don't fall into poverty because of poor choices, they fall into poor choices because of poverty. And I thought that was also a pretty telling phrase, and one we forget at our peril. And he brought home to all of us, I'm sure, the clear relevance of the social determinants of health, and the relevance of that to the work we do. And I think it's given us much to think about. And many of those factors you might think are beyond the influence of health and care services directly. So what do we do locally and nationally? It raises the question of our role in public health issues. How does that fit in with our remit? And how do we engage with stakeholders and commissioners to be effective? So a few thoughts. We already have great examples of local health watch interaction with seldom heard communities. For example, the Somali community in Birmingham, the Kurdish and Turkish groups in Haringey. But we do need to raise our awareness outside our organisations of our abilities in this area. We are and can be useful to our partners and stakeholders in this highly important work. We could improve our data about who's being engaged and how this is being done. And talking of data, it would help enormously if local health watches consistently shared their ideas, insights and achievements with us. Can we make this easier to fulfill what is in fact a duty of local health watch? You tell us. And on a similar note, could we do better in sharing knowledge throughout the network of the expertise available there already about engagement and working with partners, and also about how to meet the challenges of inequality and that we've just referred to. And indeed, talking of inequalities, we had a great session, didn't we, with a wonderful panel chaired by Alison Holt, which provoked some further thoughts, I'm sure, for all of us. There's no doubt in my mind that we need greater diversity at both national and local level in our organisations. And for organisations whose stock in trade is finding out about people's experiences, I'm sure we would do better if we were able to understand better some of those experiences from the perspective of those who share them. And that means them being part of our organisation as well as being people we talk to. Diversity is, of course, about ethnic and cultural diversity, but it's also about thought. We need to be open to people with lived experience about the way they think about things. And of course, that's not always a given. The other area which shone through our conference, I thought, has been that we no longer have to talk just about the hope or aim of having an impact to make a difference in what we do. But we can now celebrate, I think, the clear evidence that we are actually having impact, and increasingly so as time goes on. The Secretary of State referred to our role with the long-term plan, maternity mental health, A&E targets, and COVID. Frankly, his very presence, albeit virtual, at our conference, is evidence that he recognises, as he told us, the importance of what we do. NHS England is clear of the value we are regarded as bringing to discussions about issues relating to COVID, patient transport, and all sorts of other things. Our report on hospital discharge was an extremely strong piece of work, which I'm really proud of on your behalf, and I'm confident it will lead changes for the better in future. Indeed, it may already have done so. The Care Quality Commission, as Ian Trenholm told us, is increasingly aware of and using our work in its own. We even get credited for it now. But we need to build on this, what is a promising start, because that's what it is. Some good work is being done at ICS level, but we also need to get to the tables at regional level. We've made a start, but I'm sure we could do more. Finally, in this area, while the jury's still out on whether they've gone far enough, during our conference, the government has announced new guidance on visiting care homes following pressure from Healthwatch England, amongst other organisations. As I say, whether it's gone far enough is another matter, and it was telling perhaps that the press release seemed to precede the publication of the guidance by a distance. I heard a desire for us to do more to hold decision makers to account, both on the quality of their decisions and on their willingness to engage, consult, listen, before making the decision in the first place. I believe we do this, but we need to do so constructively and not by ambush for the sake of a headline or two. So constructive challenge is the way forward, but that doesn't mean we need to lack transparency in what we do. We need to strengthen our relationships locally and nationally with the organisations which themselves are able to hold leadership to account, where what we can do is insufficient. But we mustn't lose or devalue our USP. We are really the only game in town which has statutory powers to represent the voice and experiences on generic health and social care issues, and does so independently, while at the same time being publicly funded. We have to use that power wisely. We have to use our position of being both sides of the threshold in many ways, and we must base ourselves on the evidence, and we must do this in ways designed to make things better for users and for the potential of services, rather than just to stoke up a headline, which I know no one has suggested. So those are a few thoughts of mine, not in any particular order. The Healthwatch England leadership team of the committee, as you know, are considering a strategy refresh as I speak. And I've no doubt that a lot of what we've heard during this conference, and by that I mean not only what we've heard from panels, but also from you, the delegates, will feed into that. So with those brief thoughts, I'll hand you back to, or forward to, Imelda. Sorry, is someone, I think, going to talk about some of what you've been saying? Is that right, Imelda?
Robert, I'll take over from here. We thank you very much for that. We do want to hear from you. We want to hear from you about what are the main messages you're taking away from this conference. What's the things that it's helped your thinking or helped your positioning on things? What else we could have done. That would be interesting to us. And if you could use the chat box, we really want this to be a bit of an interactive. If we were actually in the conference hall, there were two things would have happened. One is you'd have come and tapped me on the shoulder and said, that person was great, but they said this, and I think they could have said that. Could you do that about it? Or Robert would have said, any questions from the floor, and you'd have all put your hands up and we'd have had a great debate. So really want to know what your reflections are on the week, what the main themes are that you think that we should pick up and you should pick up, and how we can work together on that. So just drop them in that box and we'll pick them up in a few minutes. What I just wanted to do was take you through quickly and briefly just some of our plans for the coming years, so that you get a sense of the work that we're undertaking. Firstly, I want to say, I hope you're feeling proud of the impact that we have. You've had high profile speakers every day this week. We did not brief them to say nice things about Healthwatch, I can tell you, but every single one of them did, and they really understood our role in the bigger system, and they really got that. So I hope that you're going away feeling that that we're understood at that level and appreciated. So again, if you've got comments about that or about how we further some of these ideas, in the Q&A, and we'll pick them up in a few minutes. What I just wanted to talk to you about briefly is some of the plans that we've got for the future, and particularly as they relate to the network. We, as you know, Healthwatch England have a responsibility to provide you with support and tools to help you do your job as best you can. We basically, our main job is to make sure that we bring about improvements in health and social care by listening to and acting on the experiences of people who either use services or need those services. So we're looking at how we do that. And one of the main ways we do that is by having a sustainable and high performing network. We are under no illusions about how hard it is to have a sustainable network in this environment, in this financial climate. So we are making sure that we have it as one of our primary objectives. We have had for a number of years, but we're restating it, that sustainability of the network is really a crucial priority for us. We will, over the coming, we're talking about really the next 2 to 3 years, we will continue to roll out some of the programs that we've already provided for you. We've actually co-produced them with you, including things like the quality framework, the volunteer program, training and development offer, the research governance. We're also, there are also a number of new areas that we want to focus on, and we know that that we need to make some big strides on that. And one of the things that we've got to think really carefully about and position ourselves on in the next year or so is how Healthwatch, established as a local organisation, can now, local and national, how we can now respond to the regional and sub-regional agenda. And I'd just like to ask Jacob to come in for a few moments and tell us what, bring people up to date with what our thinking is on the regional, sub-regional approach.
Thanks, Imelda. So yeah, as Imelda said, we've given a lot of thought to this because we know that the landscape in health and social care has changed significantly since when Healthwatch was created in 2013. It was back then a relatively straightforward system. You could understand the flow of between where local Healthwatch were feeding into the CCGs and the structures at a local level and feeding directly then up to national level. But in 2020, we have seen the regional decision-making levels grow massively. So we've now got decision-making and activity happening, everything at PCN level, so primary care networks. We've got CCG mergers, so their landscape is changing. We've got ICSs, STPs, ICPs, all of those set up and providing a sort of sub-regional decision-making level. And we've also got NHS England and Improvement, who've created 7 regions for the health service, so we've now got incredibly complex layers of decision-making in the system. We know that you, as a network, local Healthwatch, are already doing a lot of work to engage with your local regional decision-making forums. We've seen significant growth of that since the long-term plan work that we did in 2019. And along with that, we've also seen in some areas the NHS actually investing in local Healthwatch and commissioning you to do work at that regional level, which is such an important part of this because, as we know, as the regionalisation has grown, your remits have grown, the expectation of what you have to deliver and the pressure on you of workload has grown significantly. So it's vital that we make sure that that workload is properly resourced. So we've been engaging throughout the year with you, going to all the network meetings, having various different webinars with you to discuss what your current experiences are like, to help as we prepare for sort of further discussions about that resourcing of local Healthwatch at a regional level. In particular, we're making a strong case to the Department of Health at the moment around the proposed legislation that we expect to come forward early in the new year about the role that Healthwatch will play in any sort of new legal structures for the health service. And that's about how we can make sure that you have the right legal rights at a regional level to influence, and that point about resourcing. We've made a very, very strong case to the department that it's vital we keep local Healthwatch as part of that your links into communities that we spent 7 or 8 years building, that is the core of what we can really offer the system. And so that shouldn't be touched. What we're talking about here is trying to build our remit and give ourselves a formal footing in those regional decision-making forums. So much work to be done over the next sort of 6 months to a year on that, I imagine. But that's where we are at the moment. And please keep engaging with me, my team, anyone at Healthwatch England about the work we're doing with your ICSs and STPs, because it helps create a really rich picture of the difference you're making. So thank you.
Thank you, Jacob. So we're not making any promises, but we're doing a huge amount of work. I think it is where we are on that. We really understand the need for influence at those different levels. One of the other things we really want to focus in on in the coming years as well, again with you, we've started this piece of work with some of you, and that's around engagement techniques and influencing techniques, and making sure that we're really listening to a broad range of communities. And Gavin, I wonder whether you could come in and talk a bit about our thinking about making sure that we have all the right tools in place so that we can be really influential engagement people.
Thanks, Imelda. Yes, I think throughout the week we've heard from different Healthwatch, lots and lots of examples of Healthwatch using different ways to, to have conversations with people, listen to people, get their voices heard, and think also about the inclusion of those people in having their voices heard. So I think we want to absolutely capture what it is that you do and the range of techniques that you do. So we had a session this morning which we called sort of models of engagement, which was 3 Healthwatch, which gave their examples. But I'm sure we know there's lots of examples out there of how you do it. We want to build up a bank really of the different ways that you carry out the engagement to connect with different parts of your community. What works? What are the challenges? What can we do better? So we really want to get there. I think but equally, we also want to know what's outside of the network. So what are other organizations, not just necessarily in the UK, but what's out there in terms of what's good engagement. So we want to try and bring all that learning to the benefit of the network as well. The other element is making sure that we understand the sort of legal position of consultation. So again, we're going to be doing some work around with the Consultation Institute again to put in place some training around that. So how do you use the law best to support holding to account, etc. And then similarly, we're quite interested to look at the framework that we might have around holding organizations to account. So again, we want to do a piece of work with you around that. So how can we get sort of national framework to help support that kind of element of work? And then I suppose, the bread and butter of it, we do want to continue the dialogue and get ideas. As Imelda says, it's about co-production with you on all this. So we do have an engagement leads network that we've created. And we basically want to hear what your ideas are around this. We're going to, for instance, have some pilots soon around testing a new digital platform. Tell us whether that's going to work or not, because we could be thinking about investing in that kind of technology to help support the network and being able to engage. So these are some ideas at the moment. I think our ambition, I suppose, is where we want to get, is that we have the confidence, I suppose, around that we really do own the community engagement space, so that we're really seen in the sector that we're the people to come to when it's talking about community engagement. So I think there's been so many great examples from Healthwatch. So I think we've got all the ingredients, so we've just got to make it happen.
Thank you very much, Gavin. And one of the things, well, I hope that in some of the speakers, but also in the address from the Secretary of State that we heard on the first morning, you can see what we do with the information that you give us. When you send us insight, when you participate in projects with us, when you send us the outcome of your projects, your pieces of work, we can really do something with it that brings about change that affects everybody. So you might be able to bring about change locally, but with that knowledge, we can bring that to maybe get it into guidance or get the rules changed, like around women and having a check-in on them after 6 weeks, which your evidence helps us get. And there are a number of those things. I think Elena yesterday from NHS England talked a lot about the examples of us coming to them, talking through with them some of the things that have come from you. But unfortunately, not enough of you are sharing with us. You're not sharing your data with us. Less than 50% of you do it regularly. there is actually a legal duty to. Now, there's different ways of looking at this. One is there are barriers in the way. Otherwise, I think you would. And some of it's cultural. And some of it, which I've heard from people, is, well, I only care, my commissioner only cares about what happens in my locality. All we're asking is that you share that with us. We'll analyse it, we'll do the rest. I think we're missing out a lot on our equalities data as a result of this, because we're not hearing from parts of the country that have very diverse communities. So over the next year, we're going to be doing some really concerted work with you on how we make it easy and accessible for you to share your data, your insights, and the outcomes of your projects. Now, Chris, I wonder if you could talk to people a bit about what the plans are, please. You're on mute, Chris.
All right. I think we recognise that now more than ever, delivering the right digital systems to support our work is important when face-to-face work is as restricted as it is. And hopefully many of you in Local Healthwatch will be aware of and participated in a review that we carried out of digital systems in the early part of the year, when we engaged a digital agency to help us with some requirements gathering to understand the needs of Local Healthwatch and the corresponding solutions which will allow the sharing of data and insight with Healthwatch England. We would hope to have got back to you sooner than we have about that, but as we all know, it's been a slightly odd year. But we think we've identified the need for sort of the key tools, which is an effective set of survey and feedback tools, and a centralized data store, which will allow Healthwatch England to capture and analyze data and share it across the network. So in the next few weeks, you should see this happening quite quickly. We'll be carrying out a number of pilots. We'll be carrying out an engagement and research tool pilot to test some systems to see how they meet the needs of Local Healthwatch in terms of gathering experiences and analysing the data that you receive, and also helping to manage community and stakeholder relations. Then the other part is making sure that we have the system in place so that you can share data with us. We want to make sure we get all the data we can. As Imelda says, there's a statutory requirement there, but also the more data we have and the better the quality of it, the better the insight we can derive, and the more we can influence decision making at the centre. And we want to make sure that we provide the tools that make it as easy as possible for you to share data with us. I don't want to get too technical, but we are intending to develop our own data warehouse solution and a set of supporting tools which will facilitate the amalgamation and the analysis of the health and social care data that we receive from you. And as I said, this should also allow Local Healthwatch to provide real-time information on local issues, and also to compare available data between regions and compare with national views. So hopefully the tools that we will put in place will provide the key functionality that's been identified for both Local Healthwatch and for us in Healthwatch England. So we'll be analytical tools, full suite of engagement tools, which will allow things like polling, forums, surveys, and again, reiterating that ability to make it as easy as possible for you to share data with us. As I said, we know that the COVID-19 pandemic has really made the need for robust digital systems and brought it to the fore. So you should be hearing from us quite soon about the next steps on this in terms of the pilots that we're hoping to run.
Thank you, Chris. And again, this has been built. These ideas have been built from the work, from what you've told us, and we'll be back out in touch with you before. We'll do some pilots with you so that we know that we're on the right track. The other thing that we've talked a lot about over the course of this week is about, I think, Healthwatch's unique position in having reach into communities that I don't think any other health and social care organisation has in this country. We are in every local authority area, we reach right into communities, but I don't think we have a clear enough understanding of which communities that we're engaging with and where our gaps are. And as you'll know, and those of you who joined Joy Bison's workshop on, I think that was way back on Monday, Joy has joined us just for 2 days a week for 6 months to really help us kickstart this piece of work, but it's going to be a long-term piece of work. I think we should have great pride in our reach into communities, but we need to be able to understand it and describe it more. So we'll be back in touch about that piece of work. Joy wants to make sure that many people from the network are part of that work. And we certainly want to make sure. I think we're selling ourselves short, and I think we could do a better job of describing our reach. So we'll be back in touch about that. We will, of course, be continuing our work that we've begun around volunteering and training and development. All those things will continue, as will network development, regional meetings, and then specific meetings like the new engagement lead network that we've recently set up. So that there are going to be just quickly on the policy area, which is one of those areas I know that it would make life so much easier if we could dictate a year in advance or even 2 years in advance what those policy issues were going to be. And we're going to try to do some of that, but we did do that in this year for some of our areas pre-COVID, but also we're really clear that we need to remain reactive to what's on the government's agenda and what's on NHS England's agenda, so that we can use our influence to make sure at a very early stage that we're influencing their plans and their thinking. But we will, over the coming months, carrying on our work on dentistry, on access to GPs, and we're looking through a lot of thinking that's been going on in our insight and research team about how we can make sure that we get products and insight reports out in a much more fluid way that works for you and works for all our stakeholders. So that's another thing to watch. Again, it is reliant on you making sure that you keep us up to speed with your insight reports, with your data, with, if you don't have a report, if there's 2 sides of A4 or if it's a PowerPoint presentation, please just keep the stuff coming in, because the more we hear from you, the stronger we are. So that's a sort of a quick trot through some of the plans that we have for our interactions with the network. In saying that, the other things that we do not stop. So we will continue our work on supporting you around communications and influencing and all those other pieces of work that we continue to do. But we just wanted to take, as we were so many of us together in one place, take the opportunity to describe some of the new pieces of work that will be coming down the track. So that's enough from me. I don't know whether my colleagues would like to pop in and say anything else. No? How unusual. You must all be tired on a Thursday. Feels like a Friday afternoon, doesn't it? I notice my face is getting redder and redder. I think it's because I've been talking all day. So if I could go to Bren and to Brian, please, if you could, we can call on people to speak. Can they? No, they can't. We're on Zoom. So if you wouldn't mind reading out comments for us, please.
Well, if I may, I'm going to try a little experiment. So if the system explodes in a minute, apologies. But before we do, we've actually got a request, and it's to Sir Robert. And it's, can we see the cat properly? Oh. They've only had a tantalising glimpse, so that he's presumably keeping everybody's attention at the moment.
I'm afraid the cat has now walked off in disgust. I'm not quite sure probably what I had to say, but it usually does. She's gone back to sleep somewhere, I'm afraid.
She did join the singing and dancing last night, though. So
she did. Yeah.
So many people saw that.
I think she's got a hangover.
But the first comments we had were from Sandy, and I'm just going to try the technology and see if that works. Sandy, you may be able to unmute yourself if you're willing to.
Yes, Can you hear me?
Yes,
We can hear you.
Oh my goodness, isn't technology wonderful? Thank you, Bren, and thank you for the panel. So I just put in the chat box about the things that have struck me this week is the impressive array of speakers and how every single one of them was so informed about our work, and that's really encouraging for us here at Local Healthwatch to know that people in these amazing positions are getting such insight into our work. Health equality has just struck, and I've had a chat with a few members of my team already about how we really must all do more about health inequalities. I'm already thinking about things about doing an audit to match up to the communities that we're reaching and putting that against the protected characteristics and working out who we need to get to more. Self-care and self-management was the other thing that came up this morning so clearly for me. It would be great, I think maybe clinicians have got to let go of a little bit of power, if I dare say that, but you know, devolve that phrase about devolving you know, to patients, you know, because we're all experts in our own care, aren't we? So those are the three things, and yeah, thanks, it's been a really interesting week. I'm sorry I couldn't buy you guys a beer in the bar.
So we. They're really great points, Sandy. I just like to say, I mean, I think building on Imelda's point, I think a lot of good work is actually going on about inequalities. The more it's shared, the more we all can do better. And it's not easy, some of this stuff, but we have people in our network with real lived experience, with real expertise. Let's hear from them.
Yes, take your point about registration. Yep, I get that one. Thank you very much for that feedback. And yes, you can just buy us a drink next year, Sandy.
Just come in with Sandy, because I think for me, when I'm doing the work with commissioners, with local authorities, it's trying to get over the kind of value that Healthwatch have. So doing that mapping exercise, if we could have all Healthwatch doing that, that'd be a fantastic story to be able to tell about how you're actually connecting with your different communities. And because for me, it's around, you almost need the preconditions to be able to do the engagement. You need to have all those relationships in place to be able to do that well. And that's the kind of thing that Healthwatch do excellently. And if we could have a picture of what that looked like, that'd be just brilliant.
Yes, I mean, personally, I believe it's our uniqueness. Our uniqueness is not in lots and lots of large numbers. It's, you know, our uniqueness is in really getting into the heart of situations, into communities, and bringing that insight into the development of policy and practice. Okay, is it Brian?
Yeah, it's me. I will really try to follow Bren's example and see if we can bring in Amy Brinkhurst, who had a comment to make as well, reflections to share. So I don't know, Amy, if you're able to speak.
I am. Can you hear me?
Yes, Amy. Yes.
Hello. Yeah, I just wrote a little comment to say that I started working for Healthwatch East Sussex during the pandemic. And so it's been a bit of a strange introduction to a new role. So this is my first Healthwatch week. So I just wanted to say that I was really impressed as well by the speakers and the content. Yeah, really to say it's been quite inspirational and also helped me to understand better how what I do locally as an information and signposting advisor, how that all fits in to the bigger picture as well. So it's been, yeah, it's been a really good experience. I just wanted to say thank you.
Well, thank you to you, Amy, for joining us. And for what you do.
And perhaps I could introduce you to Brian, who also started working during the pandemic and has met none of us. Oh, did you meet Gavin once?
I've met Jacob and Chris.
Yes.
Oh, interview. It's a very we have quite a few new members of the team who've joined us during the pandemic, and I can't remember a time when they weren't in the organisation. I can't believe I've never met them. Princess is another one. I've never actually met her. I can't believe it.
I think it's worth saying to Amy, though, that sometimes it's, you know, when you're giving a piece of information or signposting and then you feed that back, it's sometimes that case study that just makes Brian's job, Jacob's job, just, you know, so much easier because they've got somebody live. And so I do want to sort of communicate to you just absolutely what a difference that all these kind of people out there who are doing that kind of role, that makes the, you know, the case studies, etc. That's the kind of thing that when we're talking about sharing the data, that's the real stuff that makes the difference.
And I do think it's probably a reflection from me on that as well, is that we at Healthwatch England need to get better at closing the loop and feeding back to people when the work that has been done locally has had that kind of impact nationally.
That's really good to hear. Thank you.
Okay, so it's over to Bren, I think.
And I was muted. We've got a question from Agatha from Brent, who I think may be able to ask it in person if she's willing. I'd like to unmute.
Hello, can you hear me?
We can.
Great. I was really quite interested in the work that you've got on digital networks, and I just wanted to find out how we would be able to join one of your pilots, because we've been doing a lot of work in Brent trying to reach across all our communities. I think we've done it quite successfully when it's come to COVID-19. So it's something we'd like to share with others and also learn from others, I think.
I can pick that one up. We're quite happy to pick up with you offline outside the conference, but we'll be sort of selecting a range of local Healthwatch from across the country to work on the pilots to make sure that we get a good cross section in terms of size and digital maturity, etc., to make sure that the tools that we're working on are going to be transferable across the network. But I'm happy to have a conversation with you about it afterwards.
Great, thanks. That'd be good.
Can I also just say, Imelda, just coming on that, so it's not about our digital infrastructure, but about engaging with and finding out how patients and people are finding digital services in the health sector. So next week we'll be making available the methodology that we're using to test out digital exclusion, digital qualities. Where we're working with 5 local Healthwatch to develop that, and that'll be published next week. So look out for that, because you may well want to, in that spirit of learning from each other, there may be some stuff that you could borrow from that. But great question, Agatha. Thank you.
Yeah, great. And where are we? Are we back with Brian, I think?
Yep, it's to me. I'm just going to see if Joy wants to speak. She had a comment and question in the chat box. So Joy, do you want to unmute?
Was it Gavin about Joy?
Hello.
So there was a question from Joy.
Right.
Yes, no, it was just responding to an earlier comment from Sir Robert, and my suggestion was that I think that it would be great if more reminders in whatever conversations and forums or opportunities you get nationally, just to highlight our unique role as Healthwatch, because we find that sometimes locally, for some of our key stakeholders, they seem to forget that we have a unique role. They seem to forget that we have a statutory role, and we're just sort of lumped in, with the rest of the voluntary sector. So that was a comment and a request. Thank you.
Absolutely agree. We do our best, and a lot of the time we tell people, reporters and everyone else, what we do, but that's the bit they always leave out whenever they report stuff. So we are making progress. We're at least getting. You read the state of care report, which I'm sure is your bedtime reading. We figure quite largely in that, and it's that sort of thing that I think will eventually get through, and it is already getting through in other places.
Okay, and so we're back to Bren.
Thank you, and I'd like to pick up.
Sorry, or somebody, I can't remember who from has said they like the experiment. Peter, please bring people in. It's nice to hear from them.
And if I can bring it in, Kat, what she says, and she might want to say a bit more about this, is she always comes away from conference feeling humbled but privileged. But she also talks about a frustrating job because the senior leadership narrative just doesn't filter down. Filter down. would you like to say a bit more about that?
Thanks, Bren. The first bit is a really genuine part, that actually we are in a very good position as Local Healthwatch and Healthwatch in general. So I never want to lose that for myself and the team. But I find working at this level, you can come away feeling like you've banged your head against a brick wall on many days, and I'm sure you feel it yourselves. That actually what we hear in those privileged conversations, both from individuals and the hardships they're experiencing because of the frustrations within the system, the inaccessibility, etc. And then what we hear at the senior level, where they speak the right narrative, so that sandwich, and it's the bit in the middle that we are often so frustrated with, that it just doesn't seem to filter down to them. So I can't begin to tell you how, if I hear B12 anymore, and the effects that's had on people, and people not getting that this is a really testing time for all of us, and we need that resilience. And if we could just empower people. So today we heard one of the speakers talking about, they're skilled at giving their own injections. And then the last conference was about, we're facing, the last session was about, we're facing the fourth one of delivering mass vaccination. Well, let's be creative. Now is the time to draw on all these resources, but can we get that through on a local level? Not often. We do have some wins, so I take those away and then rebandage my head from all the head beating on the wall.
Kat, you make a really good point, and I think you're right. It's sometimes easier to persuade very senior people of the rightness of your arguments, and much more difficult to get that into the intermediate bit, because they're looking up to their leaders, and they're worried about their own risks and everything. So that's a good message for me to take away, a bit about how, I was really pleased we got Amanda Pritchard with us today, because actually she will be quite influential in the frameworks that go out to all the NHS provider services. And so I think there's something for us to think about, because it's often, I think we're doing really well on getting the hearts and minds of very senior people, but it's the hearts and minds of the people next tier that I think we've got to do some serious work on.
I think it's a really good point, and the whole of the NHS is full of people and leaders with really good intentions, who articulate them often very well, which would be agreed with by the people who experience difficulties at the front line. But it's the people in the middle, somehow the message doesn't get through. And I think there are all sorts of reasons for that. The people in the middle, they are the most oppressed of the lot. They're having to run things, particularly at the moment, in a real crisis. At the same time as they're receiving reports and everything from all over the shop, and they're meant to be on top of those. It's a very difficult task. I think the other thing, if I'm being cynical for a moment, and of course I never am, is that it's very easy for leaders, and this, I've had no experience of this at all, of course, do I, of saying how much they welcome what we're reporting, and welcome the recommendations that people may or may not make, and of course something's going to happen about them, in the knowledge that actually they're not being held to account very well for doing it. So it will all disappear into a sort of mud and a swamp. We'll set up a working group, we'll have an action plan. So it's something we then don't, as a leader, have to think about for some time. And I suspect part of our techniques need to sharpen up a bit, not in sort of harrying people, but actually in coming back all the time to say, well, we had this meeting last year, we've now got another meeting, what's changed? And politely, if we do more of that, locally or nationally, we're more likely to get somewhere. But we will always be frustrated, because the NHS is just, the health social care system is huge, and trying to get anything moving can take a very long time, and sometimes it won't, even if we think it should. But I'm afraid that shouldn't stop us carrying on trying. That's why I'm sitting here still. Yes.
And I don't know where we're up to, Bren or Brian.
I think it's Brian.
Okay,
So
right.
I think Samantha Glover wanted to speak a little bit about the work in Suffolk and Essex. So Samantha, if you don't mind, I'll just give you the opportunity to speak.
Yeah, thanks. It's lovely to hear about all the fantastic work that's happening. It can get quite dreary at this time of year on the first day of another lockdown. So it's nice to know that there is some lights happening in tunnels. We've been working really closely as a partnership across Essex and Suffolk Healthwatch this year to look at digital exclusion and digital literacy as two quite distinct topics. So we have some people that are digitally excluded. We have those that have different levels of digital literacy. I think there was an assumption that everybody under the age of 50 or anybody with a professional qualification was digitally literate. And if you've had any days where you've shouted at Starleaf quite as much as me, you'll know that sometimes that can be a fallacy. But also some really well-meaning and well-intentioned documents that have come out have just excluded people. So those requiring on-screen readers, beautiful letters that come out with a big box around the appointment time and date. The screen reader wouldn't pick up anything in a box. So they had a letter with all this information in it and didn't understand when their appointment time was, and then got a NARCY letter to say you didn't attend your appointment. So we've been doing an awful lot to try and gather that learning in real time and feed it back into the system in real time while they are making these changes, and just really fighting the good fight to ensure that these wonderful things that are happening across the sector in terms of digital to improve services and access don't just widen that inequality gap.
Yeah. Really helpful. Yeah, really insightful. Thank you. And where are we? We're now back to Bren, I think. Bren, who must not be missed, says Peter. Never miss a Bren, says Peter.
Yeah, the check is in the post. John Redgate has asked if there are any plans for another networked engagement project. I'm not sure whether that's thinking about the long-term plan work. So John should be able to tell us if that's sort of work you're thinking of.
Yeah, we just had a feedback this time last year on that long-term plan work. It was very, it was very nice to be part of a national report. There's some important things going on to get that national, another piece of work, important work done in that way would be good. I just ask that we get plenty of notice, or
John, there is nothing in the pipeline at the moment. That's not to say things won't come along. We're having regular conversations with NHS England and Department of Health and Social Care. I think they should be commissioning us to do much more of that type of work, and they should do it with more money and a longer lead-in time. And I don't think they disagree with us. I just think it's about the right moment. So I think it was a very, very powerful piece of work, and I think it changed many minds about our status, that piece of work. It was a game changer, I think. So we're looking out for them and lobbying for them. At the moment, we are getting pieces of work through like that, but they tend to be much smaller. So 10, in 10 areas or in 5 areas. So yeah, but we know that last time it was very, very late and it wasn't enough money. So, but we thought, let's do it anyway, because we want to show our power of working together. Thank you, John. So where are we now? Bren, I think. No, Brian.
Yes. Yeah, we got one from Isabel, who wants to make a comment about any plans to engage with advocacy providers to gather experience of service users. So Isabel, if you'd like to speak, I've just given you the option.
Oh, how funny. I think I've come across on my daughter's email. My name is Fergus Cameron. I'm the proud father of Isabel Cameron for lots of reasons. Most of which was because she dragged me through the NHS service systems for 22 years, being born with a cleft lip and palate. Anyway, that's another story. My query is, and I heard the engagement with individuals and how important it was today. There is still a network of statutory provision for us citizens in the shape of NHS complaints advocates, the mental health advocate services, the Mental Capacity Act advocates, and it seems very patchy across the country where Healthwatch is involved with those advocacy providers, and they do hold a tremendous amount of intelligence, I don't like the word, but about what the individual experience is. Can there be a systematic development for relationships with those, what are statutory advocacy providers? Do you think? Or that's my question anyway.
It's a really great question, and it's one that we've been asking ourselves. So watch this spot. We're going to talk to the Department of Health and Social Care about where that sharing and learning can be, because I think it is a wasted opportunity. I think you're right. We're not joining up enough of the system from the public's point of view. So Jacob, did you want to say anything?
Yeah, I've got some slight news on this. This was one of the asks we made in our report on complaints back in January, which feels like a very long time ago now. And the recommendations we made in that were greeted positively by Nadine Dorries, the minister who's responsible for this area. And at the time we agreed to have with the minister and some other key national bodies a workshop to kick off thinking around this, about how we can do this for the department to have a strategy on how we learn from complaints, which includes this data sharing from advocacy services with other parts of the system. They rang me this morning, and the letter is in the virtual post for a roundtable meeting with the minister in the next 4 weeks. So there is movement on this, which is very positive, because, as Imelda says, it's something we've been thinking about for some time and been pushing on. COVID got in the way slightly, but we are now back up and running. So again, watch this space.
And can I just ask Fergus, was it Fergus? I think it says Fergus. Yes. Does your Healthwatch run an advocacy scheme as well?
We do. Healthwatch Portsmouth is commissioned jointly with the independent advocacy service. So the local authority has chosen to place the two statutory functions under one provider, which means that there is no GDPR holding barrier between that provider. So there isn't a wall between the two statutory functions, which there are in so many other local authorities where the provision is commissioned separately, which means that those two organisations have a much more uncomfortable time in terms of sharing information and talking to each other, and may decide, as quite rightly, that actually they have a public responsibility not to, and under their GDPR regs. So it is commissioned jointly, but it's not that common. I think there's only about 6 authorities that do. He says quietly before we go through a tendering process.
Well, thank you for that. That's been really helpful, because we will be doing that round table, and we have it on an agenda for a future meeting as well.
That's great. Look forward to hearing.
Thank you. And I don't know where we're up to. I leave it to you, Brennan. Brian, I've lost the will to live now.
I think it's...
Oh, sorry about
that.
No. Isabel, your question was perfect.
They're obviously very satisfied in Cambridgeshire and Peterborough, because we've got another comment from there, which if I bring them in, it's about something that a way of looking at health inequalities. So I'm not sure who it is from Cambridgeshire and Peterborough, if they'd like to say a bit more about what they think we could do, and maybe see if there's support for that across the network.
It's Heather from, I'm a volunteer manager. I think it's very important that Healthwatch is representative of the people that we speak to and we talk about and we listen to. And I've really enjoyed the discussion around health inequalities. I've actually got round to reading the Marmot report now as a result. So that's really been positive. I think we all have a part to play in this area, widening out the discussion around equalities per se, as Sir Michael mentioned. I think one way, I think we've already talked a little bit about this, about doing some sort of audit in terms of our diversity for staff, for volunteers, and the projects, reaching out into the communities in order for us to measure that within a year. So look at doing that now and then doing that next year perhaps, to measure our improvements. And I wonder if the panel agree, and if there are any other things that they think we ought to be doing at a local level to improve this.
I don't know whether Gavin, you want to come in, do you?
Yeah, I think I do. Yeah, absolutely. And I think I suppose that's the kind of thing we want to try and build a picture of call this year one. So Joy's going to be helping us get that picture. But I think, you know, when we look at things like the kind of information we collect off you, it would be just brilliant just to have that year-on-year view, as you say, you know, how are things progressing across the network, you know, and some of the challenges that inevitably face. You know, Imelda started by saying Healthwatch are really stretched financially, the budget pressures. So we absolutely do need to see the full picture of that. So that's the kind of thing. So if I could connect that up with the work that Chris talked about the digital, and we could have a way that would make it really easy for you to be able to report all that kind of information, that would be what success looks like for me, so that we could get that kind of picture from right across the network, and we could be saying, you know, this is the kind of network that we are, the diversity that exists within the network. So that would be a great aspiration to have.
Thank you. And I think we've come to the end of our questions. I just for sort of a few housekeeping things, Holly, when will slides and recordings of sessions be ready, and where will people access them?
So the slides and the videos will be online on the network site from next week, and we will put the link in the newsletter going out next week, and we'll just make it known to everyone.
Okay, thank you. And finally, a lot of you have completed evaluation forms as you've gone through sessions. If you haven't had a chance to do that, please do. But please keep your feedback coming. This is the very first time we've tried to do anything at this scale online, and we know there will be lots of improvements we can make. So please help us learn. And then I shall just hand back to you, Robert, for...
Fantastic. Thank you, Imelda. So it just really falls to me to say a few thank yous and goodbye, but the thank yous obviously come first. Firstly, I think it's been clear from the comments and discussion today that how grateful we all are for our main stage speakers. And as Sandy and Amy have said, their testimony to the respect in which or the status in which we're now held, that they're prepared to come and talk to us. So thank you to them, and thank you to those who organised them to come too. And thank you to all of you, all local Healthwatch and others who presented in sessions showing us great work. And as we've tried to say throughout this session, please keep on sharing. It's really great to hear from you. And everyone else who's here for taking part so constructively in this experiment, and the chat, which is distracting. The reason I'm not looking at the camera the whole time is I'm trying to peer at the chat. And the one conclusion I have is that we really are a very chatty lot. So thank you for those contributions. And I can't leave this section without, of course, giving a big thank you to the Healthwatch England staff who've put this conference together. I mean, it's an absolutely amazing effort to turn a real conference in a conference centre into a virtual one. And I mean, I think there are many aspects of this that have been probably better than the real thing. The one that everyone seems to think of is lacking is the bar, and I have to agree with that. Now, I can't name everyone who's taken part in this, but I have to give a special thanks to Holly, who's just spoken to you, Princess, Flora, and Tima, who have worked well beyond the call of duty to make sure this thing has kept on the road, or through on the broadband at least. And last but certainly not least, I'd like to give a thank you to the now most famous DJ in the world, Michael, who managed to keep many of us, not me, I'm happy to say, dancing well into the virtual night. So well done, and thanks to you all. So I just in conclusion, I think we can all leave this conference proud of the difference that we've made over the last 12 months in really tough times. And one of the remarkable things I thought about the session we've just had, but it's true of quite a lot of the conference, is that we can talk about the work we are going to do, and have been doing and are going to do, and it may have been about COVID, some of it, but there was never any sort of feeling that COVID was going to stop us doing it. And I think that's absolutely fantastic. We have managed to transform ourselves from an organization, people sitting in offices, largely going out and meeting people, into something that's virtually all online. And we're still having that impact. Fantastic. Thank you very much. So finally, these are testing times as we all sit here at home, wondering who our cat is allowed to talk to, where we're allowed to go with the dog, what sort of mask we have to wear and when, whether we can ever see our relatives in care homes again. My empathy to everyone, because we're all, everyone in different ways suffering tough times. And it's fantastic so many of you are managing to carry on doing your work for us and for your local communities as you are. But please, while you do all that, look after yourselves, look after the staff that work with you, your teams, your volunteers, and your communities. And I'm afraid that the crisis we're in is not a short one. It will last longer, I'm afraid, even than the American presidential election. But if we work together and we remember the community spirit that is available out there, which is evidenced in Healthwatch, we will get through it all. So, in the phrase of the moment, stay safe, stay well and happy. And I hope to see you all again in person very soon again. But in the meantime, of course, as ever, if you have issues you want to raise with Healthwatch England, I know our brave team on the screen here, you're only too happy to hear from you, as indeed would I. But in the meantime, have a very good journey from your chair in front of your computer to wherever you're going next. But thank you and goodbye.
Thank you and goodbye.